use your cell phone in a private institution like this in such a.
That is my paperwork from the MRI. Okay.
I'm not. Hold on one second. Let me speak with my manager real quick because I don't believe you're able to use your phone and record my.
I'm not recording. You told me no. I turned it off. I'm just telling you what's going on now.
Okay.
This paperwork right here is diagnosis of my back. Okay, from an MRI. And my primary care doctor failed to give me when he found out this was wrong with my back. This injury happened 2 years ago, 2016, December 1st. From the results of not getting the proper treatment, my feet are now going dead on me at certain times. My hands are going dead on me. The back of my legs and the side of my legs. I lost my sex drive for 2 years. I don't even care about having sex because it hurt. This doctor came in here, looked at this paperwork, and brushed it off like it wasn't nothing. Okay, it's like being stabbed and never treated for it. What you think is going to happen to that wound? Those hinges on the doors right there. If all hinges sustain an injury to them after a year, what you think is going to happen to this door? It's going to come off the hinge. He tells me that this been done a year ago. He can't do nothing with that. He don't think nothing's wrong with me. I asked him to look at this MRI. He tell me that's been done a year ago. You don't need to. I said, well, you know, what you think I should do then? He said you should see a primary care doctor. I just told him that this primary care doctor withheld information about my injury. And would he would like to please look at this MRI and tell me more about myself. And most likely refer me to another primary care doctor or just do it. He didn't want to request the MRI sometimes when I come up in here and I'm complaining about my back, most doctors will schedule me for an x-ray or something. Which he did is another deal. But from my understanding, if that shows on the MRI, it should show on the x-ray also.
So an MRI is much more involved than an x-ray.
Tissues, I know.
Yep. So
I know.
The other thing is you can show me this paperwork, but I'm a nurse, so I can't diagnose.
I'm not saying that. I'm talking about your doctor who came in here.
Yeah.
And his attitude as a doctor, like a lot of doctors I've been seeing since I've been injured, are all the same.
Okay.
No concern, no consideration, or sympathy in their patient. That's telling them that their back is out of whack. All right. I told this man that my feet are numb. I don't have no feeling in my feet. What would you do?
What can I do for you?
What do you think you should do?
So let me explain a couple things. So it sounds like you're not happy with the care you've received in the past and the care that you received during your visit today. Is that correct? So with it, unfortunately, we're in an emergency department today. So with the things that you've said to me and outlined, it does sound like this has been going on, you said, for quite some time, and that you've been trying to get some answers and some better care regarding your pain, the changes in your legs, and the numbness and tingling. Now, you are in an emergency department. So we treat, and street is kind of a term that sometimes is used.
But y'all referral thing.
Yes.
Y'all examine.
Correct.
Okay, he didn't want to do none of that.
So
he didn't want to do none of that. He didn't want to examine me properly. Or
what do you mean by examine you properly?
Like he did a flex test, and he touched me on my back and everything, right? And he said I'm normal. I'm fine. After looking at this,
So
after looking at this, he says that I'm fine.
Yep. And so again, I can't speak to that because I'm not a doctor, so I can't speak to whether
But
that
you're
is
a charge.
correct or not. I'm a
You're
charge nurse, so
and don't you should know right from wrong then, right?
yes. So
Do
what
you
I'm
think
gonna,
that was right?
so I can't practice
But wait, do you
medicine.
think that
So
was
I
right?
don't.
No, I ain't asking you to practice medicine. I'm asking you,
What I'm saying
is
is
that
I
what
don't
he's
have the
supposed to
knowledge
do?
that he has, so I don't.
But you're a charge nurse.
I'm a charge nurse, but I don't have the medical.
You're
Education
in charge
or
of making
knowledge
sure
that he
your
has.
doctors and everything do their job.
Actually, I'm not in charge of our physicians either.
This man just looked at my MRI
So
and he told me I was normal.
okay,
Is that right or wrong?
I don't, sir.
From what
if
you
the
just
physician
read.
feels that his assessment was normal, then his assessment is normal for his assessment. I can't
that's what
speak
you
to the physicians. I can't speak to his
You
assessment.
can't go over it. Then what is your job?
My job as a charge nurse is to be an advocate for patients, which is what I'm going to be trying to do for you here today. Deal with patient complaints, make sure we have throughput through our emergency department, make sure policies and procedures are followed, and so on and so forth. Again,
I just don't get it. Oh shit! I'm sorry. We was recording.
I know.
I'm sorry.
You can go ahead and delete it.